Hey everybody. I want to talk about psychosis and understanding what it means when a person is experiencing psychosis. It's when a person loses touch with reality. It means they may see, hear, or believe things that aren't real. It's not a disease in and of itself, but it's a symptom of a disease. So during psychosis, a person's thoughts, emotions, and behaviors can become confused or unusual. And people with psychosis, they're not crazy. They're experiencing a health problem, and it requires care and understanding. So some common symptoms of psychosis are going to be hallucinations, seeing or hearing things that aren't there. We call this audio and visual hallucinations. Delusions are strongly believing things that aren't true. There's disorganized thinking, speaking in ways that are confusing or hard to follow. They may have strange behaviors, acting unusually in ways that don't fit the current situation going on. And we may see a change in emotions. They could be very flat, having no emotion, or extremely emotional. So extremes. So how it looks was to see somebody who is in psychosis, talking to people who aren't there. They could be hearing voices. They could be walking aimlessly or be very agitated and not reacting appropriately to good or bad news. So what can cause psychosis? It can happen for different reasons. There could be organic causes, like a physical health problem. Could be a brain injury, a brain infection like encephalitis, epilepsy. There could also be, tumor-related, brain tumor-related causes, depending on where the tumor is. There's substance-induced psychosis. So drugs like LSD, methamphetamines, even heavy alcohol use can lead to psychosis, as well as withdrawal from substances, in particular alcohol. There are psychiatric causes for psychosis: schizophrenia, bipolar disorder during mania or depression, and severe depression, also called psychotic depression. So how do we figure out if somebody's experiencing psychosis? What's the medical evaluation look like? So the provider will do a full body checkup. They may run blood tests or brain scans like an MRI or CT to rule out injuries or diseases. And a mental health evaluation, talking with the person about their thoughts, feelings, and behaviors. Any family history of mental illness or substance abuse may also be helpful. But it's important to note that doctors need to rule out any medical causes first before assuming it's psychiatric. So, how do we treat psychosis? Psychosis is treated with medications, antipsychotics like Risperdal or olanzapine, to help reduce the hallucinations and delusions. Of course, I've talked about side effects of antipsychotic medications, and those all still apply. There's also therapy, cognitive behavioral therapy, which I've mentioned previously, talking about depression. It can help people challenge the scary thoughts and build their coping skills. Then there's family therapy, to educate the families on how to support their loved one when they are experiencing psychosis. And then social skills training to help them reconnect with daily life. So it's possible to live with psychosis as part of a disorder, managed with medications and therapy, and a supportive family can lead to good outcomes and a fulfilling life. But it's also important that someone experiencing psychosis, if they become unsafe to themselves or others, that they seek inpatient treatment right away and get managed medically with medications from a healthcare provider. And I will talk to you next time.